My name is Peter Strong. I'm a professional online therapist specializing in mindfulness therapy, which I offer via Skype. So if you're interested in talking to an online therapist via Skype to get help with anxiety or depression, or to get help with recovery from an addiction, or to work with agoraphobia, or to work with OCD and intrusive thoughts, or if you'd like to schedule Skype therapy sessions to help you overcome driving anxiety, or many other common forms of psychological and emotional problems, then feel free to reach out to me by email. Go to my contact page, contact me, tell me more about your particular needs, and feel free to ask any questions you have about Skype therapy and how it can help you with your particular needs. Skype therapy describes psychotherapy that's provided online using Skype so you can see each other. This is really quite important. Being able to see each other makes the therapy sessions effective, and really there's no difference between Skype therapy sessions and sessions in person with a therapist. You don't need to be in the same room together to receive good quality psychotherapy, but you do need to see each other. That is quite essential. So if you are interested in Skype therapy with me, then please contact me and learn more about the process that I teach online. So I specialize in mindfulness therapy, which is particularly good for working with difficult emotions, especially anxiety and depression. The way that it helps you overcome the debilitating effects of chronic anxiety or chronic depression is that it helps you break free from that blind habitual reactivity that feeds anxiety and depression. This is the real problem that we have to address. And often just talking about your feelings is not enough to really change these underlying habits. That requires a very direct and conscious process, which is exactly what mindfulness therapy is. It's a way of establishing a very conscious relationship with your emotions and also with the thoughts that tend to feed emotions, whether that's catastrophic thinking or chronic worry thinking or rumination, obsessive thinking. These thought patterns are very important causes of our anxiety or depression. They are the fuel that feeds these underlying emotions. So that's part of the reactive structure of anxiety and depression. Now it's by seeing these, by bringing conscious awareness to see how that works, to see all that reactivity very clearly, in detail, that makes the difference. This is what we need to see, because most of the time these reactive processes run as subconscious habits. We don't really see them. We just experience the end result, which is emotional suffering. So in mindfulness therapy, we use meditation as a way of examining our emotions. We learn to watch the emotions like watching a movie on a screen. We train ourselves to become the observer. Now, the observer is not the same as the anxiety or depression. The observer is the one watching the anxiety or depression. So training in this process of mindfulness actually frees you or liberates you from that emotional suffering, because it stops you falling in to the stream of reactive thinking, and it stops you identifying with the emotion and becoming overwhelmed by the anxiety or depression. So learning to see the emotions objectively, developing what we call objective consciousness or mindfulness, is essential for breaking the habits that create our anxiety and depression. So I will teach you how to do this, how to meditate on your anxiety or depression or other emotions using mindfulness during our Skype therapy sessions together. The process of learning how to work consciously with your emotions is incredibly powerful. And that's different than talking about your emotions. That's a second-hand process. Being directly present with your emotions is what actually helps them heal and basically burn themselves out or resolve themselves. So the more conscious you are of your anxiety or depression, the faster they heal, the faster the emotions heal. So we meditate on our emotions in order to develop this objective consciousness. We also bring in other elements such as compassion and friendliness. These are both components of mindfulness. Mindfulness is more than just awareness. It is consciousness combined with a quality of compassion. And compassion is also a very powerful force for healing. So we learn to sit compassionately with our emotions, and we learn to respond compassionately to those emotions to help them heal. And we very often do this by working with the imagery of the emotion. So typically when people are meditating on their emotions, they will start to see imagery. This is a fundamental part of the structure of all emotions. So for example, you could explore the color of the emotion. So depression most likely will have a dark color. Black or purple are the colors that are most commonly reported for the emotion of depression. Anxiety tends to have a brighter color, orange or red. It can change between different people and at different times, and that's the whole point of mindfulness training, is to look and see what color is it. That's very important information. It's direct structural information. You could say quite accurately that that emotion has to be dark or black in color in order to create depression. It has to be orange or red in order to create the feeling of anxiety. It's part of its structure. So color is important. The size of the emotion clearly is very important. It is not possible to be overwhelmed by an emotion that's very tiny in size. It has to be big. Also, if it's overwhelming, that tells you right away that it has a position. The position is a high position above you or at head level, but it's basically in a high position which gives it power. That's a psychological parameter of power. So the height of the emotion is quite important. we can move it, we can change its colour. And this is part of the response of compassion. It's real action that you do during your meditation as you start to see clearer what is happening, what's going on in the mind that creates the anxiety or depression. You then respond in a skillful way. That's part of meditation. Meditation is not just a passive process of watching. It's also has an active component of response. We call that the response of compassion. You're trying to help it heal. Right? So we build a conscious relationship with our emotions, and we develop compassion towards our emotions, and then we investigate what constitutes skillful action that would help the emotion heal. Simple things like changing its colour, making it smaller, moving it, putting it in a position where you can care for it, like holding it or embracing it, can make a huge difference and speed up that healing process. And that's, of course, the objective of mindfulness therapy, is to heal emotions. So I'll teach you how to do this in great detail during our Skype therapy sessions together. If this interests you and you would like to learn how to apply mindfulness for overcoming anxiety and depression through Skype therapy, then simply contact me and we can schedule some sessions together. Thank you.